Welcome back to The Full View. Following 30 years of democracy, South Africans are facing a devastating crisis of under as well as overnutrition with staggering levels of non-communicable diseases. Now, the health of the nation is tied to the ability of its citizens to realize their right to a healthy life, as the Constitution recognizes the right to health as well as food and incorporates the principles from international treaties, which places a duty on states to prevent non-communicable diseases. Professor Petronell Kruger, a Healthy Living Alliance Program Manager, joins us to hopefully share with us what some of the solutions are in this regard. Professor, a very happy Human Rights Day to you. Thank you so much for joining us. Look, a terrible predicament or position to be in as a country, right? If in the last 30 years, such statistics still paint a stagnancy in progressive health standards, where are we going wrong? What can be done to change the tide?
And maybe just to, 100%, that's such an accurate reflection. And we're saying we're celebrating 30 years of democracy. And why did we attempt to achieve that democracy? It's because 30 years ago we said that every person should have a dignified life. And before we even go to more advanced things like being able to express yourself online, really the underlying factor is that people need to be able to eat enough and be healthy. And that is what the Constitution purports to do by guaranteeing within the Constitution that you have the right to access to sufficient food. Yet we see two things happening. We see at the moment 8 million children experiencing hunger. And on the other end of the spectrum, we see that South Africa has one of the highest rates of overweight and obesity. So what are we doing wrong? We have a broken food system. We have a food system where people are not given information and people are given access to inadequate food. And what we mean with that is people are given access to food that is inherently unhealthy. So that would be things that are not minimally processed. So if you or any of your viewers have ever wondered or said out loud in the last few years, it's crazy, it feels like cancer rates have gone up. There's so much high blood pressure, heart disease is such a big problem, and we don't remember it being so 10 and 20 years ago. That's for a very good reason. And that is because our diets have changed significantly. And Statistics South Africa have said within the last 20 years, non-communicable diseases has skyrocketed with 60%. This is frankly South Africa's next HIV and AIDS pandemic. And this is killing, at the moment, 1 in every 2 South Africans. And if this continues, we'll see it being closer to 2 in every 3 South Africans. So what do? We need to make sure that people, we need to make sure that people have access to information and that the government steps in to create healthy food environments. And that means 2 things. It means making sure that people can firstly access food, because hunger is still a problem. So right now, the food poverty line is just below 650 Rand. And we need to have a very difficult and serious conversation as a country as to universal basic income, because we just simply cannot say that we're a country devoted to democracy and dignity if we're not willing to make sure that at least every person in the country has something to eat. And then we need to start to saying that people need to know what's really in their food. So you can do a few things, but number one, right now, the Department of Health has a draft regulation that we need to support as the public, which is a front of pack warning label. And it's actually the bare minimum. It's asking the Department of Health to tell food producers that if food has a certain ingredient that might be unhealthy, that they actually just need to tell us what it is in plain language on the front of the package. And it's as simple as that. And that will make a massive difference in how we as South Africans eat.
Very interesting indeed, Prof. Back to those stats. I mean, according to research, 1 in 8 South African children are overweight, which is double the global average, with experts warning, of course, that children experiencing early childhood obesity run a higher risk of a multitude of related challenges, like you mentioned, diabetes and high blood pressures. Like in my intro, I made mention that South Africa has a problem of both under and over nutrition. But how do ordinary parents, guardians, citizens then strike this fine balance between the two, where the harsh economy has left consumers with very little choice of quality, healthy food options?
And just to say, Alicia, I'm not yet a professor, but thank you. I like to think we're peering into the crystal ball for the future. But really, what I think the number one thing for parents is to start demanding that there's healthy food environments. So to start asking very serious questions to their local municipalities and to the government that allows fast food outlets close to their children's school, that have unhealthy things like sodas being sold in school environments, and for parents to also understand that things, for example, like fruit juices is not as healthy as they believe it is. We need to create a food environment where there's a demand for healthy food and where we actively tell the government that we reject unhealthy food practices. And really, this is something as a country that we've been struggling with. I mean, we remember when we had the crazy listeriosis outbreak, the biggest one in the world with 1,000 people dying. We remember when we had that terrible incident of those children dying because they ate bad food. And really, these are things that with government regulation we can resolve, and that other countries have managed to resolve, and that we have the infrastructure to resolve. And the wonderful benefit is that if we as a country eat healthier, we save 33 billion rand. So there was a study done about 2 years ago by the University of Witwatersrand where they indicated that overweight and obesity costs the country on a lower end 33 billion rand each year. That's not factoring in COVID. That's not factoring in several other considerations. Really, as a country, if we force government to give us healthy food, to make sure that they tell big corporations they're not allowed to lie to us, either directly or by omission, they need to inform us what's in our food. We can save our own lives and save money.
Absolutely. Thank you so much for that. That was Healthy Living Alliance Program Manager there, Petronell Kruger. Up next is Xoli, standing by with your sports.